Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for the condition constipation. Okay, so the definition of constipation, it is the slow, difficult, or infrequent movement of feces through the bowel, and it is considered a symptom rather than an actual condition. So it's just a symptom. Take note of this, guys. It's just considered a symptom, okay? It's not an actual condition. So it is maybe due to a physiological cause or a perception that the elimination process is not happening with normal frequency. Okay, so up to 25% of the population feel they suffer from constipation. Okay, so movement in the digestive system. All right, so the digestive problems result in the change and movement of the fecal matter, the feces, through the gastrointestinal tract. Okay, so the stomach and colon tract. Movements in the colon are segmental movements, okay, so sometimes referred to as mixing movements, contain the fecal matter, so absorption of substances can occur through the intestinal walls and into the bloodstream. Okay, segmental movements. Now, in the small intestine or intestine, nutrients are absorbed, and in the large intestine water or intestine water, and electrolytes are absorbed. Okay, so next is the propulsive contraction. Okay, so the propulsive contractions are those which move the fecal matter through the colon towards the anus, okay, the feces. There's the so-called peristalsis, guys, so you'll remember of this. It refers to smaller, more frequent propulsive contractions. So down the gastrointestinal tract, the peristalsis movement is always happening. Okay, so take note of that. Peristalsis, this word. Okay, so it doesn't open. This doesn't only happens in the gastrointestinal tract. It also happens some areas. Peristalsis. Okay, so the mass movements, which refer to infrequent but powerful propulsive contractions in the large intestine or intestine. Okay, so mass movements, we could call that in the large intestine or intestine. Over 24-hour period, an average of 4 to 6 mass movements occurs in the large intestine. So for a day, it's an average of 4 to 6 mass movements. That's what we call it. It's not peristalsis anymore. It's mass movements in the large intestine or intestine. Okay. Causes of constipation. So there is the lifestyle factors that include poor diet. Okay, just read on the information. There's sedentary lifestyle. Okay, so there's resisting to urge due to poor or inadequate toilet facilities, travel, or lack of an appropriate opportunity to defecate, to remove the bowel. Okay, so one is stress. Okay, it causes constipation as well. So postural imbalances that contribute to the inability of the abdomen, diaphragm, low back, and gluteal muscles to contract effectively. Okay, so pain in these muscles can also lead to muscle guarding and in turn constipation. So yeah, postural imbalances, guys, due to lifestyle factors, causes constipation. Okay, so there are physiological factors as well. So it contributes to constipation. Physiological factors include poor muscle control or muscle tone or lack of coordination, such as would cause weak abdominal and diaphragm contraction. Inability of the pelvic floor muscles to relax with defecation or moving the bowel, or to co-contraction of the gluteal muscles, the buttocks muscles, and external sphincter when defecating. So there are sphincters externally, so at the anus while you defecate, okay, or move bowel. you move the bowel. So these are factors causing, affecting constipation. Now, psychological factors such as depression. Here you go, guys. Eating disorders, anorexia, obsession with inner cleanliness, denial of the actions of the bowel, or addiction to laxatives and other purgatives such as enemas. Okay, so medications, side effects as occur with opiates, anticholinergics. These block parasympathetic nerve impulses, the antidepressants and anticonvulsives medications. So if you're taking these medications as well, guys, that can cause constipation. Now, post-surgery effects, especially abdominal surgery. So if you undergo abdominal surgery, it will result in paralytic ileus, okay, pertaining to paralysis in the ileum. Okay, this refers to the absence of motor activity in the large intestine or intestine for approximately 72 hours and incoordination of the stomach and small intestine or intestine function for 24 hours. So after surgery, abdominal surgery, you're gonna be experiencing constipation. So I guess this is normal. Okay, so gastrointestinal conditions, stomach colon conditions such as irritable bowel syndrome, diverticular disease, megacolon or enlarged colon. Okay, obstruction. So there's obstruction. Colorectal, cancer, colon and rectum cancer, and Hirschsprung diseases. All of these diseases are gastrointestinal conditions. Okay, so physiological and structural disorders such as rectal prolapse or internal and external sphincter abnormalities. So sphincters, like it's a ring-like structure that holds, controls movement of the bowel. There's internal, inside the colon, and there's the external. You see the end of our anus, that is an sphincter is located. So it closes the anal canal. Okay, external sphincter. Okay, if there's abnormality, then well, of course, it's gonna affect too with constipation. Now, pregnancy and early postpartum. So most women who are pregnant experiences constipation as well, and early postpartum after giving birth as well. The first 6 weeks of childbirth. So first 6 weeks, there you go, guys. You're gonna get constipation. Now, underlying disorders such as hypothyroidism. So if you have this condition, hypothyroidism is low metabolism, and hypercalcemia, excessive calcium in the blood, and diabetes. Okay, so it's common, guys, diabetes, as well as neurological disorders, pertaining to nerves such as Parkinson's, multiple sclerosis, hardening of the sclerosis means hardening, so multiple hardening in the some tissues in the body, and sacral lesions, sacral, pertaining to the sacrum. So if there are lesions or any opening, in the tissues in the sacrum region. Okay, so some causes have variable effects on the colon. In some cases, a condition leading to pain in the colon or pain upon defecation, bowel movement, such as hemorrhoids. Okay, so hemorrhoids is familiar to most of us, guys. So it's in the anal canal, the external, the outside, protrusion, like it's the tissue in the anus is outside, protruding outside, can result in constipation. Okay, now we go to the symptoms. So there are a few symptoms for constipation, so just read on this, guys. Take a look at this. So let's move on to the part 2 of the treatment plan, which is the subjective component. So it involves the health history questions. So in this level, you're gonna ask these questions. These are the questions that will be helpful in assessing for this condition. Now, one question is, how is the client's general health? So you're gonna ask the client this question first and foremost, and then what indicates to the client that he is constipated. So I'm gonna ask this question: is there straining, pain, or small stools? Another question: is the client taking any medications that could result in constipation as a side effect? So again, medications, guys, that the client is taking. You're gonna ask, most importantly, has the client consulted a physician? So has the client, you know, have seen his or her family physician regarding his condition about the constipation? Okay, you have to ask this question. Does the client have any idea what may be causing the constipation? You're just gonna ask this client as well. How long has this been present? So how long the constipation problem has been there? Okay, or the client has been suffering. How frequently is the person having a bowel movement? So how often does the client go for do his bowel movement, like in a day? Okay, how is this different from his usual pattern? So if he goes for bowel movement, twice or thrice a day, or a normal bowel movement, then how is it different when he's having this, problem constipation from the normal bowel movement or his normal pattern? Now, what is the consistency of the fecal matter? Okay, so consistency, you're gonna ask the client the appearance of the feces. Okay, is it soft, which is normal, hard, slow transit time, thin, increased tone in the colon, lumpy, spasm in the colon? So if the client shows these symptoms, then you see lumpy, there's spasm in the colon, or variable, alternating diarrhea and constipation can indicate irritable bowel syndrome. Okay, so alternating diarrhea and constipation can indicate another condition, which is the irritable bowel syndrome. Now, what is the color of the stool is very important. This is one question you should ask. So black could indicate distal colon bleeding. Distal means the lower colon, lower part of the colon bleeding. There's bleeding on the lower part. Red could indicate intestinal bleeding. So if the feces is color is red, that means there's bleeding in the intestine or intestine area. Okay, or hemorrhoids. Hemorrhoids, that protrusion of the tissue at the anus, at the external part. Hemorrhoids, a light color could indicate bile. Okay, light color bile. And hepatic disorder, meaning it pertains to the liver. There's a problem in the liver if there's a light color. Okay, and a whitish coating indicates, so if there's whitish coating on the feces, indicates a coating indicates mucus. See, if you see a whitish coating on the feces, it indicates some mucus from an intestinal disorder such as irritable bowel syndrome. So there's mucus, you have a disorder, pertaining to your intestine or intestine, like the irritable bowel syndrome. So when you see these symptoms, guys, on the fecal matter, then you're gonna be able to assess the disorder of the client with regards to constipation. Now, is there any pain present when the client tries to remove his or her bowel? Then if there's pain, then you're gonna ask the client as well, what type is it? So what type of pain? When and where does it occur? So what type of pain? Is it dull, achy, but shooting? Kind of. You have to ask the client, describe the pain. And when and where does it occur? So when does the client, feel the pain? Is it during, or after or before doing the bowel movement, or where? So where? You're gonna ask the client. So where does the pain occur? Okay, it's very important. So what aggravates the pain? What increases the pain? Okay, you're gonna ask the client in relation to constipation. What relieves the pain? So if the client has constipation, so what does the client do to relieve him or her, to reduce the pain that the client is having in relation to this condition? Okay, has the client done anything to relieve the constipation? So did the client do anything to reduce the relieve him or her of the condition of the symptom of constipation? It's not really a condition. Okay, are laxatives used? So does the client use laxative to to reduce constipation, to you know get a relief from this symptom, from this problem, constipation? If so, what kind and how frequently? So what kind of laxative, the name of the laxative, and how often? You're gonna ask a client how often, and the client, if he or she is using less, how often does he use laxatives? Okay, what is the client's general lifestyle? There you go, guys. So you're gonna ask the client this question. It's important as well. What are the stress levels? So, if the client is undergoing some stress at work, with family, any kind of stress. Does the client exercise frequently? So here you go, guys. You're gonna ask the client if the client does some exercises, if it's frequent. Does the client allow himself time to have a bowel movement? Okay, so the client is not really, trying to just endure, or take a long time to do bowel movements. So it's prolonging. You're gonna ask the client about this as well. Now let's move on to part 3 of the treatment plan, which is the objective component. So you're gonna do your assessment in this level. Now, one of the assessments is your observations. So for the observation, you're gonna observe if there is bloating of the abdomen, very important. A postural assessment is performed to check for imbalances. Okay, so just read on the information here, guys. Okay, so you're gonna do palpation as well. So you're gonna do palpation on the abdominal area, and just read on the information here, guys. Okay, so you're looking for tenderness as you palpate. Okay, there's pain on the area as you palpate. Okay, next is you're gonna do testing. So you're gonna do active free AF and passive passive resisted range of motion, or PROM. You should do this. And you're gonna do active resisted strength testing as well. Okay, on the muscles. Just read on the information, guys. Okay, yes. Commonly, you're gonna do special tests. The popular test, special test to assess for constipation, general constipation, is the rebound test. Okay, and if you do the rebound test, the test will be negative for general constipation. Okay, so rebound test, you do this test and you're gonna find a negative result for general constipation. That's how you determine constipation problem. Okay, so for contraindications and precautions, should be not doing any massage if somebody has these contraindications, and precaution, you should be you should modify if there's a need to. So hydrotherapy, application of heat on the abdomen. So if somebody is constipated, take note, guys, you don't apply warm pack or heat pack on the abdomen or on the stomach area. It should not be used if the client has any history of increased blood pressure or cardiovascular problems. So any blood pressure, if the client has a high blood pressure and any cardiovascular problem, then you do not apply heat pack or any warm hydrotherapy on the abdominal area. Okay, so any cardio, heart and any high blood pressure and heart problems. Okay, also heat would not be used if the client has an inflammatory bowel disease that is flaring up, that is active. Inflammatory bowel disease, so there's inflammation in the bowel, in the colon. There's this kind of disease, so you don't apply heat for any inflamed area in the colon. Okay, if the client has this flare up or is active this disease. Now, diarrhea is a contraindication to abdominal massage. So very important, if the client is having diarrhea, pretty much you have to stop or you don't have to do the treatment. Or you have to tell the client that you cannot do the treatment for massage because diarrhea is a no-no. It's a contraindication, okay, to abdominal massage. All right. So no abdominal massage if the client has diarrhea. Okay. Let's come to part 5 for treatment plan. Okay. You should follow these goals. So you have to reduce stress. The goals for the treatment plan is to reduce stress, decrease sympathetic nervous system firing, your fight and flight response, decrease pain, of course, reduce the pain. You have to address contributing postural imbalance. So if the posture has imbalance, then you have to address that. You have to, educate your client, teach the client, for good posture. Decrease hypertonicity, tightness and trigger points, a painful, tight, with the referral pain areas in the lumbar spine. So lumbar spine meaning on the lower back area. And gluteals, which means the buttocks muscle or buttocks area. Now encourage diaphragmatic breathing in and breathing out. You have to encourage the client to do this breathing. It's going to be helpful. Okay, decrease congestion in the abdomen. So tell the client to decrease any congestion in the abdomen area. Increase circulation to the abdomen. So you have to increase circulation to the abdomen area, to loosen up the stool, the hard stool, feces. Okay? So you have to decrease hypertonicity and trigger points in the iliopsoas, so the muscles located inside. Okay? Just the on the hip region, and it attaches to the lumbar spine, the lower back area, and it attaches as well, inserts into the greater trochanter area, the hip region, the hip area, the femur, the upper part of the femur, the greater trochanter area. Okay, the bone. And you have to move fecal matter. So if you feel like having, to go to the washroom, the washroom to remove your bowel, then you have to really once, every day you need to go to remove your bowel. Okay. Maintain range of motion. Okay, so you have to make sure you move your joints, range of motion. So that would prevent from from getting reduced movements on your joints, especially the hip joints. Okay, the hip area. Okay. So for positioning, pillowing, and draping, so there I have a few information here. Just take a look at this, guys. For the techniques, I have a few here, so just read on these guys or take a look at these guys. Additional information for techniques, just read on these guys. So we're done with techniques. We're gonna move on to hydrotherapy. So this is the use of either warm hydrotherapy or cold hydrotherapy. Okay, so this can range from warm to cool applications. All right, so warm applications such as heating pad may be placed on the abdomen to increase local circulation. Okay, here you go, guys. So if there's no contraindications, then if there's no cardiovascular conditions or high blood pressure, then you can apply warm hydrotherapy application on the abdominal area to increase circulation, like blood circulation or lymph circulation on the area. Cool or cold applications act to stimulate the colon. Okay, so you can apply cool, cold pack, ice pack, or cold compress on the abdominal area to stimulate. So to stimulate the colon, so to loosen up, to stimulate the muscles in the colon so that it can loosen up the hard bowel, okay, or the hard pieces or the that causes constipation. Now they include a cool wash or a heating compress. Okay, so cool wash or heating compress. The hydrotherapy applications will also reflexively decrease sympathetic nervous system firing. Okay, so with warm or cold, it's gonna decrease your fight and flight response. Okay, the sympathetic nervous system firing. Okay, let's move on to the general treatment. So the general treatment is the goal is to decrease sympathetic nervous system firing and decrease pain. Okay, so decrease your fight and flight response and you decrease pain. Now, a smooth, very smooth rhythmic pace is used. So slow, smooth, and rhythmic pace is used. Okay, so full body rhythmic techniques and effleurage are used throughout the massage. Okay, here you go, guys. So for specific treatments, you are to address contributing postural imbalances. Okay, so you have to advise the client or look for postural imbalances. Okay, decrease hypertonicity, so to decrease tightness of the muscles on the area, and trigger points in the lumbar spine and gluteal. So you're gonna massage the lower back, the lumbar area region to decrease tight muscles, to loosen up tight muscles, and the reduce trigger points. So any area with hardened or not, if there's not or a tight tissue with pain, and most of that has referral pain, then you have to reduce those trigger points. Okay, in the lumbar spine, and the lower back area, and the gluteal area, which are your buttocks muscle area or buttocks muscles. Okay, other information, just read on this, guys. Next is to encourage diaphragmatic breathing. Okay, the breathing in and out. You have to teach your client to do that, especially at home. Decrease congestion in the abdomen. Okay, so you have to decrease any congestion in your abdominal area. Okay, stomach area. Increase circulation to the abdomen. So you have to increase your circulation, blood circulation, and lymph circulation in the stomach area, the abdominal area. So information are here. Just read on this, guys. Next is to decrease hypertonicity and trigger points in the iliopsoas if present. Hypertonicity, you have to decrease tightness of the muscles, the iliopsoas muscles, which are located on the inner side of the hip area. So it attaches to the lumbar, all of the lumbar spine vertebrae. It originates there, and it inserts or attaches to the greater trochanter, the hip area, the greater trochanter area of the femur bone, the upper part of the femur. Okay, so you're gonna loosen up the muscles there, and trigger points of these muscles as well. So like I said, trigger points are those areas in the iliopsoas muscle that has pain and tight tissue, and most of the time has referral pain. Okay, so you have to reduce those. Now read on the information here, guys, for this to how to decrease hypertonicity and trigger points in the iliopsoas muscles. Okay, so you have to move your fecal matter. You have to do bowel movement. Okay, so information of how to do this are on this. Just read on this, guys. Take a look at this. Then you have to maintain range of motion. Okay, so rhythmic movements of the hips are performed by placing the hands loosely at each side of the waist and gently rocking back and forth. Okay, this one movement is good to do this. Okay, to maintain range of motion. Passive relax. Okay, range of motion of the hips and knees is interspersed in the treatment. So you're gonna, as a therapist, you're gonna be doing, doing the movements on the hip to move the hip joint. So during your treatment, okay, it's your job. Okay, you have to do this to maintain range of motion. It's very important. Now let's move on to part 6, which is the self-care plan. Now the goals here are to educate the client. So hydrotherapy used in treatment, such as hot or cold compresses, is recommended. So you're gonna educate, you're gonna tell your client how to use hot and cold hydrotherapy. Okay, Epsom salt baths are useful, so you're gonna teach your client how to use this as well. Now self-massage to the abdomen is demonstrated by the client to use at home. So you're gonna teach the client how to self-massage the abdominal area. Okay, and a lotion enriched with an essential oil can be used. Okay, if the client has no allergies to lotion with essential oil, then the client, you can ask the client to use this lotion with essential oil that can reduce constipation or relieve client from the constipation problem. Okay, now next goal is to promote an exercise regime. Okay, so what's a general exercise program you have to give a client, such as walking or swimming, or as well as Tai Chi or yoga. These are helpful for the client at home. Okay, physical activity after eating reflexively increases mass movements and has been found to be helpful for those with constipation. All right, so you're gonna teach your client for these exercises to do at home. We call this remedial exercises, self-care exercises. Next goal is to refer the client. So if you think like you need to refer the client to a naturopath or nutritionist for diet counseling, if it's appropriate, then you refer your client. So increased intake of water and fiber is encouraged. So you're going to tell your client to increase their intake of water, drink plenty of water daily, and food with lots of fiber. Okay, biofeedback can be leaned to retain the bowels, especially when problems of poor coordination of muscle contractions cause the constipation. Biofeedback. Okay, now the next design is stretch and strengthening program as indicated. Okay, so you're gonna give your client exercises that will depend on the specific results of the postural assessment. Okay, so if the client has weak abdominal muscles, Active resisted strengthening exercises such as curl ups are recommended. Okay, take note of this, guys. If hyperlordosis, excessive curve on the lower back, is seen or apparent, quadriceps and psoas stretches are given. Quadriceps are the muscles located on the front, on the interior part of your upper leg. Psoas, like I mentioned, is on the inside of the hip area. Okay, if a C curve scoliosis, so if you have scoliosis, is compressing unilaterally or on the abdomen. So if the client has a C curve scoliosis, so there's a curve towards the side scoliosis, and if it's compressing on one side on the abdomen, then heel sitting exercises are suggested. Okay, heel sitting exercise. Just research on what heel sitting exercise you can find. Okay. Next is you have to encourage relaxation, most important. So diaphragmatic breathing. You teach the client how to do breathing in and out, like diaphragmatic breathing. Encourage that. It can facilitate bearing down or moving, bowel movement, and to increase overall relaxation. Right? It's gonna relax the muscles, and it's gonna the muscles can do their action, their job to, to move the bowel or the feces smoothly down for defecation or for bowel movement. Relaxation techniques such as meditation are important. Okay, if you can teach your client about meditation, the use of lavender essential oil may also facilitate relaxation. Lavender essential, like I said, if the client has no allergies to essential oils, then you can ask this client to use this. Okay. 25 drops of pure essential oil are mixed in 50 ml of carrier oil. So there you go, guys. So this is how you mix the essential oil. The mixture can be massaged into the abdomen or put in the bath. Okay, so 50 ml of carrier oil. So 25 drops of pure essential oil. So 1 to 3, 25, then into the oil, and then you can use it to massage your client or into their bath. Put it into their bath. Okay, the client can do that. Now, for education, to educate about bowel retraining, so you're gonna teach your client. The bowel can be retrained over time. This is especially important for clients who have chronically resisted the urge. Chronically, like, for a long time, they resist the urge to go to do defecation or to remove the bowel. First thing in the morning, the client eats a price. Sorry, it's not a price. It's a piece of fruit and drinks a glass of warm water. Okay, it's a piece of fruit and it drinks a glass of warm water. All right, so you're gonna, advise your client. He then sits on the toilet for 10 to 15 minutes. This is repeated at the same time. If the morning is not convenient, then another time is chosen, usually following a meal. Okay, because squatting with the hips flexed is the optimal position for defecation. The client may wish to place a stool in front of the toilet to put his feet up on, increasing hip flexion and facilitating bearing down. Here you go, guys. This is just 10 to 15 minutes, okay, to urge the client to do bowel movement every day. Okay, so for treatment frequency and expected outcomes, the client's treatment should be twice a week for 2 weeks. So 2 times a week for 2 weeks, then once a week for 2 weeks. So first twice a week for 2 weeks, and then once a week for another 2 weeks. Okay? If there is a postural cause, it will need to be addressed in order to relieve the constipation. So we've been mentioning about postural imbalances. So guys, you have to really check on this. You have to address that, okay? If the cause is chronic pathology or medication, so chronic pathology, a condition or disease that has been there for a long time, or if the constipation, the cause of constipation is medication related, what kind, as I mentioned on the health history, so what medication can, can trigger constipation, or treatment will be ongoing. So for with this, the treatment should be ongoing, okay? And resisting the urge or dietary causes will require client compliance in order to deal with the constipation. Okay, so if the client does not do bowel, bowel movement regularly, then you have to let them do it. Okay, sit down on the toilet for 10 to 15 minutes. Put a stool on the feet to raise up a little bit for more flexion of the hips, to induce bowel movement. And by eating a piece of fruit and warm water drinking before doing it, that could help, okay, with dealing with constipation. So you really have to get the client be compliant with all this in order for them to get the relief of this constipation problem. Okay, so here you go, guys. This ends our video for today. Our treatment plan for the condition of constipation. Like I said, it's not really a condition, it's more of a symptom. And thank you for watching this video, and I would like you, please subscribe, like, comment, and share this video. Thank you again, and you have a great day.